Hi there, I'm Gwendolyn Dirk, and I'm here to get you up to speed on Oregon's House Bill 3134. So this bill focuses on gold card prior authorizations and the overall prior authorization process. So if you don't know, gold card prior authorizations are these programs that several states throughout the US have adopted. They aim to streamline the process of prior authorizations by creating exemptions for certain healthcare providers based off of eligibility. Now, as you can imagine, there are very key variables in this legislation that will determine its effectiveness and the spread and the reach of its legislation. So one of those key variables is the actual eligibility itself. And this can include the time period of evaluation for eligibility. It includes the actual cutoff for eligibility, and it includes who or which specialties are going to be eligible. The services included in the program and how many are required for evaluation of eligibility. For example, if some programs will set a minimum number of claims that need to be submitted for each healthcare service in order for it to be evaluated. And if you don't meet the minimum number of claims, then that service is automatically excluded. And that can exclude a lot of providers and a lot of services if that minimum number is set too high. The process of reporting claims and who's responsible for this process, as well as the degree of the transparency of this process, can vary. And who determines what is evidence-based practice and what clinical criteria should be covered and approved can vary and is a critical piece to these bills. And then, of course, which insurers are going to be included. So for our bill, for House Bill 3134, it does include eligibility criteria and specifics on a gold card program. It also requires that the prior authorization data be made publicly available. And then it's going to apply to all commercial healthcare insurance, all coordinated care organizations, the Public Employees Benefit Board, and the Oregon Educators Benefit Board. So as it currently reads, House Bill 3134 defines its eligibility in this way. It's going to apply to all healthcare providers, and it will be sliced, again, by each healthcare service or claim or procedure code. And a provider needs to have 80% approval during the previous 12 months for that procedure code. And then the exemption period they'll be awarded is 12 months. And providers won't have to apply for these exemptions for each healthcare code. It's something that insurers are going to do automatically. And then the last piece is that if a provider's not meeting the 80% approval criteria over the previous 3 months, or if the last 5 claims were denied as deemed by the insurance company, then the insurer can discontinue the prior auth exemption. I think this last piece is really the Achilles heel of the bill, and it can limit the effectiveness of this. So the Oregon Medical Association has proposed some amendments to the bill, and they're very big amendments and important. So the very first one that they proposed actually gets rid of all of that eligibility criteria that we just went over. And instead, it says that insurers have to adopt some form of a gold card program that essentially will decrease the burden of these prior authorization requirements based off of provider performance. But it removes all the specifics and just gives a lot back to the insurer to determine the specifics of the bill or of the program. Now, the next piece is that it requests or amends that the insurer is also going to now post the requirements for each healthcare service, including that clinical criteria on a public-facing website that's readily accessible, that's standardized and in a searchable format. Now, this is a pretty big change and a big request. It really spells out that that clinical criteria has to be included, and it includes that the wording around documentation also has to be included so that providers know exactly what's needed for each healthcare service to get it approved or not. And this really changes the way the bill currently is written, because the bill currently allows for more vague statements on each service rather than really spelling out the clinical criteria. Additional amendments that the Oregon Medical Association proposes is that this data needs to be all publicly available, including the approvals and the denials of the prior authorization requests. In addition, it puts a lot of onus onto the insurers to do an annual utilization management review that then gets submitted to the state insurance commissioner, who's going to review these annual reviews and identify any of the prior authorizations that are interfering with access to quality health care, maybe that are worsening healthcare disparities, or if they deem that they're just for the economic benefit of the insurer, the health insurance commissioner will be able to get rid of those. And this amendment is key in that it really puts the onus onto the insurer and the responsibility onto the insurer to do these reviews annually, rather than the insurance commissioner being responsible for doing investigations after enough complaints have come in. So it really is more proactive. Another amendment that's proposed that starting in January 2027, insurers will need to actually have a software program that automates the entire authorization process and allows providers to search to find their prior auth procedure, what clinical criteria and documentation is going to be needed for approval of that, and then to facilitate the electronic submission of these prior auths at no cost to the provider. In addition, they ask for a licensed physician to supervise the use of these automation tools and these AI tools while this is a new thing, to make sure that it's doing things correctly and safely. It says that denials must include what other treatments and care are going to be covered. And it also adds dental, which is pretty great and self-explanatory. One of the amendments also includes that once a prior authorization for a surgical procedure is approved, the insurer can't deny any additional healthcare procedures that are deemed medically necessary. Insurers also will have to respond within 24 hours to prior authorization requests. This is, I think, a game changer. It will really change our wait times. And if additional information is needed, once that information is received by the insurer, they will again need to respond within 24 hours. And finally, insurers will have to accept all retroactive authorization requests, and they can't deny a claim solely based on time. Overall, how this helps, it's going to increase the transparency of our prior authorization process. It's going to require this to be submitted to the state and then publicly available. It'll improve patient access to care. It's going to reduce prior authorization denials and delays. It's also going to hopefully reduce the administrative burden by really streamlining the whole insurance process, and hopefully that will also bring care costs down. It'll allow providers to now focus more so on patient care. Here I've created some talking points for your advocacy day. I'm happy to talk more with you about this bill. I think it can do a lot of good, both in its current form and also with those really important amendments that the Oregon Medical Association has proposed. Feel free to pause this to read through. And if you have any questions, please feel free to reach out. Thanks so much.